Namaskar. The concept of safe donor harvesting. Nothing to disclose. The implanted hair follicles shall stay permanently, grows naturally, and should have been harvested without compromising the donor aesthetic. This is the concept of safe donor harvesting, and there are three components. One component is stay permanently, means you should harvest them from safe donor area. B is they should grow naturally, means you must harvest healthy hair follicle. C means they should have been harvested without maintain the donor aesthetic, means harvest within the safe excision limit. So these are the three components of concept of safe donor harvesting. Now first A is the concept of safe donor area, means the Unger, Bernstein, Rassmann, Cole, Alt has done various studies and they come out with that hair follicles on the back side of a scalp are not androgen sensitive and they are not liable to fall under the effect of DHT, and when these grafts are harvested from here and up and implanted in the recipient area, they remains permanent, and this is the reason and this is the logic of the hair transplant as well. Then occipital, parietal and lateral side of the scalp has different nerve supply, indicating that this area has got different embryological origin than the skin on the top of the head. Third is the 25% of the total scalp area is permanent, and out of this 50% of this can be harvested without compromising the donor cosmetic density. Then fourth is on an average 5 to 6,000. Sometimes if density is very high, then 6,500 grafts can be harvested from the scalp donor area in multiple sittings. Then as per the Cole, the area of safe donor is around 203 square centimeter. Then the question is safe donor area is really permanent? Let's discuss. The Unger has done again the studies. He came out that the person age of less than 80 years, they do not go for Norwood grade 7. So we can say a patient of less than 80 years of the age, the defined safe donor area will be permanent up to the age of 79 years. So that is the concept. Defined safe donor area is said to remain permanent based on the various studies. Now let us see this. The width of safe donor area, family history of baldness, age, severity of baldness and patient compliance for the medical treatment, and you should do the local examination of safe donor area, see for anagen telogen ratio, you must also see for the retrograde alopecia. Then for progressive thinning, you must examine the area by wetting the donor area. Then a rough calculation of superior border of safe donor area 6 cm below the center of the whorl is another criteria of the occipital fringe of safe donor area. This is the patient having the retrograde alopecia, so you must consider these are the two patients. One patient is showing the thinning and another is really unsafe to do the harvesting from this, so you must first build up and you should know the treatment. The advantage of FUT donor area or FU is that the strip which is harvested in FUT is in the most central part of the safe donor area, so we usually call it the sweet area or the most permanent donor area. Now let us see the boundaries of the safe donor area. First take the occipital protuberance, then we take a meatal line, then 2 cm above the superior helix we take another point called as the B point. Then from B point 6 cm in the same meatal line we take another C point. So these 3 points, occipital protuberance A, B and A and B, are basically making your inferior border. Now we need to take another point, that is in the midline, central point of the superior safe donor area, you take a mid-occipital vertical line, then you take a horizontal line which is joining your B points, means 2 centimeter above the superior helix. So this makes where these two line crosses makes your D point. So this is the superior border of midpoint of the superior border. Now you join the dots, superior border and then the anterior border. You join all. This is your safe donor area. Cole has also called it as the major zones of the safe donor area. Then as per the Cole, we can also take, if retrograde baldness is there, not there, then FUE hair follicle can be harvested even just below the occipital protuberance, but you must see for the miniaturization, you must see for the retrograde baldness and all that. And some person in FUE, they also harvest the graft just anterior to your anterior border of the safe donor area, although I don't do that. So this is the safe donor area boundaries. Now this is the Cole, we all know. He has divided into multiple segments of different size and you can make this. Now many times when the surgeon is harvesting, he forget that he is crossing the safe donor area limit. So initially many of the surgeon limits their shaving. They don't shave the total donor area, they only shave the safe donor area and later on then they can shave. So this will automatically prevent them crossing the safe donor area limit. Then B concept is the maintain the donor aesthetic, means prevent the donor harvesting when overshooting of the safe excision limit and use of relatively large punch of harvesting can make your scalp show. When we see such a scalp, I really feel that you are burning the scalp of your patient. I think this is crime. Then another is, if you are harvesting very closely, this is going to cause the necrosis and the scarring, and this is the over harvesting giving the significant scalp show. I feel if surgeon is doing too much close harvesting, doing over harvesting, you are destroying the house of someone. You are destroying the aesthetics of the patient, donor area, which should not be done. Now, let's think why surgeon does over harvesting. One important thing is he must be having the lack of knowledge, means safe excision density limit he may not be knowing it, and sometime to meet with the unrealistic demand of the patient and to compensate his high transaction rate and the poor result, he harvests more number of graft, which is probably one of the common cause. Now various donor defects because of the over harvesting, like telogen effluvium, another telogen effluvium. This is extraction in limited area using the large punch. This is a hypopigmentation because of the larger poor quality of the punch. This is over harvesting. In spite of that, poor results is there. This is harvesting non-uniform extraction leading to moth-eaten appearance or the poor donor aesthetic. So the surgeon should make a balance between the donor area supply, recipient demand and the patient's expectation. So how to avoid the over harvesting? The surgeon should know the safe excision limit, residual density, he should do the donor area evaluation, hair mass concept, optimum punch size, and how to minimize the transaction and how to give the best result. So the important factors for graft excision is safe excision density is the number of the graft harvested without compromising the cosmetic density of the donor area. Now most FUE experts recommend that 10 to 15 grafts excision per square centimeter as a safe single pass density in a person with baseline average density of 65 to 75 grafts per square centimeter. But other surgeons like James Harris and even myself go for higher excision density in one pass, means 20 to 25 grafts. with a rough estimate of 20 to 25% of existing donor hair follicle can be harvested in single pass. Of course, it depends on the thickness of hair, color of the hair, curl of hair, and the presence of multifollicular units. Then the residual density. Residual density is the donor density left after the excision. That is the donor density, and the concept is if the donor density after your all extraction is less than 30 or 40 grafts per unit, then the scalp will show visible scalp show will be there, means the poor donor area. So let us take an example of one patient is having 70 grafts per square centimeter. You extract 10 to 15 grafts, then you are left with 55 grafts. Then again you go in second pass extraction, again you extract 15, then you are left with 40 grafts. If you continue extracting at this level, third time, again you harvest 10 to 15 grafts per square centimeter. At the end of 3 extraction, your donor area will have only 25 to 30 grafts per square centimeter, and this is going to give you a significant scalp visibility, which is not good. Now the coverage value. The scalp area covered by the hair mass unit means the hair density into hair thickness. Supposingly 100 hairs are there per square centimeter, hair thickness is 0.05 mm, you multiply, then the coverage value is 5. So coverage value, if it is low, then it is going to limit your safe excision limit. So it's good to know the coverage value. I feel the hair is a cylindrical structure, and so far till date we are considering only the thickness of the graft, but I feel we should give the length of the hair also in consideration while calculating the residual density. Let's take an example another. If a area is having 25 grafts per square centimeter, I excise 25%, then I'll be left with 18 grafts per square centimeter. You can see reasonable, very good coverage of by the existing hair. Now another is if you do 30%, still hairs are covering your scalp. If you do 50%, even then it is reasonable. But if you go further, then more scalp skin than the hair, and you will have the significant scalp show. Then another point is the punch size. If your punch size is larger, means let's take 1 mm punch creates 60% larger scar than the 8 punch. So this is 0.9 and this is 1 mm. You can appreciate the difference. Now, how the pattern of excision should be? One should not excise them too close. As side it is going to give necrosis. If you are doing linear excision very close, again it is going to give a cut or necrosis. So a uniform extraction from all the areas should be done to have a good donor aesthetic. Now, many times one person is extracting more from one area and not from another area because he is more comfortable in that position. So this creates ununiform extraction leading to moth-eaten appearance, which is not good. So one can divide scalp area in multiple segments and he can prevent the ununiform harvesting. Now another concept is do not excise all the members of the family, which is a common temptation. Then another is do not extract all multifollicular unit from one area. Now again I am giving one more concept. When you are going for second and third pass excision, the two words I am adding is the orphan hair. Orphan hair is a hair which is a single solitary hair in one skin zone. If you excise, this become alopecia. Another is excise or extract the graft which has a nearby graft or had been shadowed by another hair. So we call it a shadow hair. So excise a hair which is shadowed by another hair. Now third component of safe donor hair harvesting is healthy hair follicles should be harvested. So prevent the transaction and extract the graft healthy, means various injuries should be prevented, and to reduce the graft transection, epidermal brush centering is the main key point. So this is a learning module. You can see in Cutaneous and Aesthetic Surgery Journal and read it in detail. This is important that you use two forceps extraction technique of your dissected graft to prevent the various type of injury in the graft. So various injury can be partial transection, full transection during the dissection, and during removal of the dissected graft there can be capping, there can be plug, there can be desheathing, there can be fracture, and there can be iatrogenic splaying, which should be prevented. Now if you follow all the basic concept, you can take care of your donor area. Like we have harvested 3000 graft, still it goods. Another case 2900 graft, then again we harvested 1800, donor aesthetic is maintained. Another case 3245, donor aesthetic is maintained. Another case, this is also good even after harvesting of so much. So it looks that I haven't done the extraction. If you follow all these concepts, this is not difficult to achieve, my dear. So learn hair transplant properly, go in the depth of it, learn each and every step, read, then practice, work under any expert FUE surgeon to learn the techniques and to learn the depth. So you need not to hire a driver who is not having the license. Unfortunately, many times the doctors has got the license but they don't know how to do the hair transplant. So they hire a technician and they are sleeping or sitting in their chamber and their assistant is doing everything and we are blaming the assistant. So this is basically fault on the surgeon's aspect. Without learning hair transplant, we want to earn the money. This is crime and it should be stopped. Thank you very much.